Hey everyone, in this video we're going to cover the brachial plexus. This is the bundle of nerves that's coming out from C5 to T1. These nerves, all of these do innervate the muscles um, of that arm from your shoulder all the way down to your fingertips. Really, the ones that we need to know in this undergrad course are going to be 1 through 5. That's what you're really going to be tested on in like lab and in lecture. And depending upon your professor for lecture, 6, 8, 9, 13, and 14 are also going to be tested on. So uh, there's that for you. I'm not going to cover all of these in this video. I can cover them in the complete anatomy video just because I think they're easier to see and where you'll be able to um, rotate the image. You know what I mean? So, a couple of things you'll want to know from this page as well is the injuries. So, crutch palsy, that's coming from damage from that radial nerve. Um, that's uh, also known as Saturday night palsy. So, like, best way to explain it is a guy and a girl sitting on the couch. The guy puts his arm around the girl, and all of a sudden his fingers are going numb, right? This is due to this radial nerve kind of being um, pinched in a way to where you're losing that feeling. If that makes sense. Carpal tunnel syndrome, that's going to occur uh, in your wrist. That's coming from that median nerve, number 2, that's causing this. You'll feel it in only some of your fingers, the tingling. So it's going to be your thumb, your index finger, and then it's going to be half of your middle finger if it's true carpal tunnel syndrome. Erb's palsy, you'll also hear of it as like waiter's tip. So go to a high-end restaurant, waiter's taking you back, and they throw their hand just backwards at you, down by their waist. It's called like a waiter's tip. Like you pay them. On the way to your table, they'll take you to a better table. Um, that's where that came from. So that's kind of what that hand will do is like it's coming back and it's kind of stuck in that position. Um, and then you have Klumpke's palsy. They also call it claw hand, and that's caused from damage to that ulnar nerve. So you'll want to know those for your test. And then MMURA is the acronym that is going to help you to remember the first 5, which is your musculocutaneous, median, ulnar, radial, and axillary nerves. Let's go ahead and scroll down right here. The nerves for C5 and C through C7, these nerves right here, they're going to exit above the respective vertebrae. So if you have nerve C5, it's going to exit um, above it between C4 and C5, those vertebrae. Whereas nerve C8, that's going to exit below. So that nerve is going to exit between uh, C7 and T1. That's where that one's going to exit. All right, so we're looking at this. This all of this is like your brachial plexus, really. Um, that one is the one that you really see coming through between middle scalene and anterior scalene. Coming down, this green one right here, that one is going to be number 1. That's going to be your musculocutaneous nerve. Then number 2 is going to be this orange one right here. That one's going to be your median. Number 3, this is going to be your ulnar, right? Because it's coming down to the pinky. And number 4 is going to be your radial. because it's coming down where the radius is. And then number 5 is up here at the top. This is your axillary nerve. Nerve number 1, your musculocutaneous. That's going to innervate your coracobrachialis, your brachialis, and then your biceps brachii. Number 2, which is your orange one, that one is going to innervate all of your forearm flexors except for your flexor carpi ulnaris. And then number 3, being your ulnar nerve, it's going to innervate flexor carpi ulnaris and flexor digitorum profundus. Number 4, this is going to be your radial nerve, and it's going to innervate all of your forearm extensors as well as your triceps. And remember, it's coming around in that radial groove, along with that profunda brachii artery. And then number 5, that's going to innervate your deltoid and your teres minor, which kind of makes sense. You look in here, that axillary nerve is coming deep. It's coming on the posterior side of that humerus. It's coming up. Your deltoid's coming down into that deltoid tuberosity. So look where the bulk of that nerve is, sitting right there where that deltoid is. And then you have these branches coming up, and we know that that teres minor is the most posterior, most lateral muscle that sits on this greater tubercle. So if you think about it like that, it's going to help you make sense of it. So that's it for this video. I know it's not really much, and we haven't covered the muscles yet if you're following the book in order. So I encourage you that after you learn the muscles, you go back in and look at the nerves, and then go back to the muscles and write in which nerves innervate them, and that'll help you remember. So if you have any questions, reach out, and we'll see you in the next video.
All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.